So we're live on Freedom Radio here from Bat's Barbershop at 5911 Penn Avenue, and I'm sitting here with Dr. Maria. Tell us a little bit about what you do.
Hi, so I am from the Graduate School of Public Health, University of Pittsburgh. I'm an MD professional, but I'm getting my master's in public health, and I'm here volunteering with the Center for Health Equity. And we're here with Take a Professional Day to take blood screening, blood pressure screening, and give information about health and wellness.
Great. This is exciting. So I have to tell you, my first experience being introduced to the Take a Professional Day, I actually was on that van kind of riding through the community and seeing how it was so impactful. Got to meet so many wonderful healthcare professionals like yourself that are really committed to bringing this kind of work into the, areas that don't necessarily get wide access. Tell me why maybe the graduate school does this, or why you think this kind of work is so important that you're here today and spending your time.
Yes, so it's very important that professionals also come into the community. A lot of people are intimidated about going to the hospital or going to the doctor, especially males, and so that I think is very important to come into the community and also bridge that gap between the healthcare professionals and academics, people from the university, people from the community coming into these kinds of shops where it's relaxed setting, great conversations, great people know each other, and they're not intimidated. So it's a great access, and I'm so happy to be here.
Good, I'm glad. It's good. It's exciting to be able to have this chance to talk to you. And so, when someone is coming in and interested in getting their blood pressure screening, and I know there's a series of questions that are asked beforehand. Can you tell us what those questions are and why they're even asked in the first place?
Okay, sure. So first I ask about their name and their age, their background, whether they're African American, white, Asian. I also ask if there's any family history, hypertension, if there's any family history of diabetes. Those are very important. I also ask about when their last screening was, when they had their last blood pressure screening, or when they actually thought. That's very important too, to get a baseline level, and whether they have any history of smoking or alcohol intake. So that is also a question.
Right, absolutely. So, have you seen or have you gotten a chance to see? I know personally, I've talked to a former professor at Duquesne, within Duquesne's nursing school, who mentioned how people had this kind of event, and a gentleman was like, "No, I don't want to get my blood pressure taken," but he got it taken anyway. He was leaving work, and once his blood pressure was taken, they told him how high it was, and he reluctantly left anyway, even though they said he should definitely go to the doctor or to the hospital. But eventually, because his blood pressure was so high, he decided to, go to the emergency room and get checked out. And they told him that, he was just, moments away from like frying his organs because of blood pressure. Why is it so important to make sure that we have a healthy blood pressure? What does it affect internally?
Okay, so what it affects a lot of it would actually prevent a lot of diseases further on. For instance, it's a preventive strategy. I think it's important to check early and to implement some prevention measures early on to prevent things such as a heart attack or stroke or diabetes or kidney disease. So all of these can lead to further problems later on. So if you find out early, the sooner the better. Find out where you're at, and also be able to educate people about it. We have also healthcare here that are in insurance, like Gateway here, people helping people with acquiring. So I think if it's a community setting where we can bring all these different resources together, I think that's very effective, especially when you said that although they come in here, get the blood pressure taken, notice that it's high, but they leave not doing anything about it. So we have other people here with us today to give many resources and to also give education and support. A lot of times we are at a loss. These people where they're not coming into clinical settings setting or a hospital to get checked out, this is a perfect environment.
Absolutely. Well, I'm really excited that you're here. So I couldn't leave without getting my blood pressure checked,
Okay.
right? So I guess I'm about to get my blood pressure checked. I haven't actually, to be quite honest, I'm one of those people who have, as little preventative care intervention as possible, just to be quite honest, just because I feel as if, maybe my diet can take care of it, or maybe if I'm just, in tune enough with my body that I'll be, alleviating or not worrying about having to worry about all those things. So I guess I better get my blood pressure taken.
Yeah, so let's begin. And usually I ask your name and your age.
Okay, I'm Latoya and I am 30 years old.
Okay, 30 years old. And if you had your blood pressure checked, when was the last time you remember, and what was the number?
Oh, wow. Well, I did let one of the nursing students earlier take it, but I didn't get my number.
Okay.
But before that, it's probably been years, and it was probably somewhere in the 180 over 60 and 70 range, so not too high. Yeah.
180 over 180 is pretty high.
Okay.
So let's check it again.
Yeah. Okay.
And I would like to know if you have any history of tobacco intake or any alcohol intake.
No,
Okay.
I don't.
Any family history of high blood pressure?
Yes, I actually was, had been diagnosed, I guess it is, with high blood pressure as a young girl. So when I was younger, I did have high blood pressure.
Do you remember the value?
I don't actually, but I was really little, so I had to go on this whole restricted diet. I was a big bacon eater.
Okay, that'll do it.
I was a bacon eater. When my doctor told me I could only have 2 slices a week, I said, "Did she mean a day?" So I was like, you can't be serious. I'm supposed to be restricting my bacon, but now, it's not a problem. Yeah, now I totally understand.
Yeah. And you're not alone. I think a lot of people don't want to actually give up a lot of things that they love to eat.
Absolutely.
So let's check your blood pressure now. And is there any medications that you're on?
I am. No, not at all.
And just relax.
Oh, okay, like that. Okay.
I was there at practice, it was really my first year playing for real. So, I got good towards the end of the season. In 8 months. Good. Bad.
Okay.
I have good news for you. It's not that bad.
Okay,
it's actually
good.
130 over 80.
Okay.
So and the normal is 120 over 80.
Okay.
So when we see blood pressures like that with your age, we wouldn't want to medicate you. We would actually like to be able to address it by preventive measures, by reducing salt intake, watching your diet, and exercising.
Okay.
Since we don't smoke and drink, that's not an issue, but I think what needs to be done is that you can bring it down to normal levels, which is 120 over 80.
Okay.
So 120 is a high number, and 80 is a low number.
Oh, okay. So 80 is actually a low number. 180 was probably okay. So that's why you said it was high. So, got it.
So now you know your baseline is 130 over 80. So you would want to bring down the 130 to 120. But that's very easy for your age. I think if you watch your salt intake, drink lots of water, fruits and vegetables, as often as you can.
What kind of things send up your blood pressure? Now, I know that there's two different. There's like the diastolic, right? And then there's something else the systolic,
so
right?
The systolic was the 120 or the 130 number, and the diastolic is the 80.
Okay.
So we want to bring both of them down relatively the same. If we can.
Okay.
For your age, it's very easy to bring down the systolic.
Okay.
With just some modifications, lifestyle modifications. And for instance, if you have a high salt diet, you want to reduce fatty foods intake, you want to modify that.
Right.
And also watch your weight, but I don't think you have a problem with that. With weight and just adapting like a very healthy lifestyle. Start small and always drink water versus soda.
Okay.
Substitute things, and if you feel that, for instance, you want to make something with cream cheese, maybe low-fat cream cheese, or substitute cream cheese with yogurt.
Okay.
So find fun ways that work for you.
Yeah. So
Modify your diet.
are there chances that someone who is relatively healthy, that doesn't necessarily take in a high sodium diet, that they might encounter a high blood pressure? What would be some of the reasons for that?
Okay, so some of the reasons where the diet is fine and the weight is fine. People who probably have high blood pressure, it could be because it's hereditary. So it's already in the family history. So they would have to watch out even more for it not to be higher than
Gotcha.
yeah.
Okay. Good to know. Well, thanks for taking my blood pressure. I appreciate you being here. I mean, it's really valuable to have you in these places for all the reasons that you explained. We don't necessarily, we're not necessarily open to going to a clinical setting, and we don't always have access for one reason or another, whether it's finances or healthcare issues, insurance issues.
Yeah.
So I appreciate it. Thank
you so much. You love that bacon.